Welcome to Doctor Mai, sharing medical knowledge. Today's topic is tinnitus, a condition that fills your ears with sounds only you can hear. It's a common issue affecting over 50 million people in the United States alone, with the potential to seriously impact daily life. While tinnitus isn't a disease, it's often a symptom of an underlying health condition. Though there is no cure for tinnitus, healthcare providers can offer treatments to help manage its effects and improve quality of life. Before we dive in, don't forget to subscribe, like, and comment below the video to support the channel's growth and help us bring you more valuable topics. What is tinnitus? Tinnitus, pronounced as tinnitus or tinnitus, is the medical term for hearing sounds that aren't actually present in the environment. People with tinnitus often describe hearing ringing, clicking, pulsing, humming, or rushing sounds. These phantom sounds can range from barely noticeable to so loud that they drown out real environmental noises, making it difficult to concentrate or sleep. This constant noise can lead to frustration, anxiety, and even depression. People suffering from severe tinnitus often experience significant disruptions to their daily routines and social interactions. How common is tinnitus? Tinnitus affects approximately 15% of the global population. In the US alone, over 50 million people experience it, particularly individuals between the ages of 40 and 80. Although anyone can develop tinnitus, it becomes more common as people age, especially in those who suffer from hearing loss. Possible causes of tinnitus. The exact cause of tinnitus isn't fully understood, but it's often associated with underlying medical conditions. Some of the most common causes include age-related hearing loss. As we age, the sensitivity of our hearing diminishes. The brain, used to a certain level of auditory input, compensates by creating phantom sounds, leading to tinnitus. About 1 in 3 adults over the age of 65 will experience this. Noise-induced hearing loss, NIHL. Repeated exposure to loud noises, such as music concerts, machinery, or explosions, can damage the hair cells in the inner ear, leading to hearing loss and tinnitus. Ear injuries. Trauma to the ear, such as from an accident or head injury, can disrupt the nerves that transmit sound signals to the brain, resulting in tinnitus. Ear infections or earwax buildup. Both conditions can cause temporary hearing loss and, in some cases, tinnitus. Medications. Certain drugs, including some antibiotics, antidepressants, chemotherapy drugs, and nonsteroidal anti-inflammatory drugs, can cause tinnitus as a side effect. Less common causes include Eustachian tube dysfunction, Meniere's disease, an inner ear disorder that causes dizziness and hearing loss, temporomandibular joint disorders, vestibular schwannoma, a non-cancerous tumor on the vestibular nerve, otosclerosis, abnormal bone growth inside the ear, blood vessel disorders, which may cause pulsatile tinnitus, where the ringing happens in sync with your heartbeat, autoimmune diseases such as lupus or rheumatoid arthritis. Tinnitus triggers. For many individuals with tinnitus, certain triggers can worsen symptoms. These triggers may include stress, sleep deprivation, loud noise exposure, fatigue. By understanding these triggers, many people find that managing their stress and improving their sleep quality can help reduce the severity of tinnitus flare-ups. How is tinnitus diagnosed? If you suspect that you have tinnitus, it's important to seek medical advice. A healthcare provider, usually an audiologist or ear specialist, will conduct a thorough examination to determine the cause of your tinnitus. This examination may include hearing tests. Audiologists use tests like pure tone audiometry, speech understanding, and tympanometry to assess your hearing ability. Blood tests. These help to rule out underlying conditions like heart disease. Imaging. In some cases, a healthcare provider may request an MRI or CT scan to get a closer look at your inner ear or brain, especially if a tumor or other structural issue is suspected. Treatment options for tinnitus. While there's no cure for tinnitus, several treatment options can help you manage the condition effectively. Treatment depends on the underlying cause. For instance, if tinnitus is related to earwax buildup or an ear infection, Addressing those conditions may alleviate the symptoms. However, if tinnitus results from hearing loss, healthcare providers may focus on helping you adapt and manage the condition. Here are some common ways to manage tinnitus. 1. Sound therapy. Many people with tinnitus find relief through sound therapy, which involves using external sounds to mask the ringing in their ears. This can be done with white noise machines, devices that produce a consistent background sound, like rain or wind, to distract your brain from the ringing. Noise generators. These in-ear devices emit continuous low-level noise to help minimize the perception of tinnitus. 2. Cognitive behavioral therapy. CBT is a form of therapy that helps people manage the emotional impact of tinnitus. By changing how you think about tinnitus, CBT can reduce the distress it causes, helping you lead a more comfortable life despite the persistent ringing. 3. Hearing aids. People with hearing loss often benefit from wearing hearing aids. These devices amplify external sounds, making tinnitus less noticeable. 4. Medications. In some cases, medications such as antidepressants or anti-anxiety drugs may be prescribed to help manage the emotional impact of tinnitus. Living with tinnitus. Tips and tricks. Living with tinnitus can be challenging, but many people find that adopting certain strategies helps improve their quality of life. Avoid loud environments. Loud sounds can worsen tinnitus, so it's important to wear ear protection when exposed to high noise levels. Manage stress. Stress can exacerbate tinnitus, so practicing relaxation techniques like deep breathing, meditation, or yoga can help. Sleep well. Poor sleep quality can make tinnitus more noticeable, so establish a good sleep routine to promote better rest. Complications of untreated tinnitus. If left untreated, tinnitus can lead to anxiety, depression, irritability, cognitive decline, difficulty concentrating and communicating. Seeking early intervention is important, especially if your tinnitus symptoms are affecting your mental health or ability to function in daily life. Can tinnitus be prevented? Although tinnitus can't always be prevented, especially if it's related to hearing loss or other underlying conditions, you can reduce your risk by protecting your ears. Use hearing protection when exposed to loud noises. Avoid prolonged exposure to loud sounds, including through headphones and earbuds. Monitor medications. If you're taking drugs known to cause tinnitus, talk to your healthcare provider about possible alternatives. When should you see a doctor? You should schedule an appointment with a healthcare provider if you experience ringing in your ears lasting more than a week, hearing loss, dizziness or vertigo, tinnitus that syncs with your heartbeat. If you experience sudden hearing loss along with tinnitus, seek immediate medical attention, as treatments are most effective within the first few days. Final thoughts from Dr. Mai. Tinnitus is a common condition that affects millions of people worldwide. Although it can be frustrating and difficult to live with, there are many treatment options available to help you manage your symptoms and improve your quality of life. If your tinnitus is persistent or interfering with your daily activities, don't hesitate to consult a healthcare provider for further evaluation and guidance. Thank you for watching today's video on Dr. Mai, sharing medical knowledge. Don't forget to subscribe, like, and comment below the video to support the channel's development and bring you more great health topics. Take care.